Okay, what if I told you that three diseases you'd never think to connect are actually tangled up in a dangerous new health crisis? We're talking about one ancient disease, one brand new one, and one chronic condition. Today, we're going to unpack the surprising links between tuberculosis, COVID-19, and diabetes. Here's how it all fits together. So, let's start with a really startling fact. For years, we were making real progress in the fight against tuberculosis, TB. But the World Health Organization is telling us that progress has actually been reversed. Just between 2020 and 2022, all the disruptions from the pandemic led to over 500,000 extra deaths from TB. And infection rates, they've bounced back to being even higher than they were before 2019. Not good. So the big question is, why? What happened? The answer? Well, it's way more complicated than just people missing doctor's appointments. It's really a story about a perfect storm where one massive crisis slammed right into another one and created something totally new.
And our story really begins not in some high-tech lab, but on the ground, in a place that was already facing some pretty big health challenges, the US-Mexico border.
See, this region has been a known hotspot for tuberculosis for a long time, with rates way higher than the national averages. And this is mostly driven by things like poverty and just not having easy access to healthcare. But there was always another big player in the mix here, type 2 diabetes. It's a well-known risk factor that weakens your immune system, making people way more vulnerable to TB. So you can see, this was already a really dangerous combination just waiting for a spark.
And that spark, that new explosive ingredient that got thrown into this already fragile situation, that was the COVID-19 pandemic.
This is a quote, word for word, from the researchers who figured this all out. They literally called it a perfect storm. The idea is that the immune-weakening effects from both diabetes and a past COVID infection could combine to just dramatically crank up a person's risk of developing active TB.
And the numbers behind that storm, honestly, they're staggering. Researchers found that, having diabetes alone increases your odds of getting TB by about 2.7 times. But what about a person with diabetes who had also had COVID in the past? Their odds skyrocketed to 7.9 times higher. Let that sink in. That's almost a 3-fold jump in risk just from having had COVID on top of diabetes. So what this means is, it's not just about hospitals being busy during the pandemic. The data is pointing to a real biological interaction where diabetes and a past COVID infection are working synergistically. Their combined punch is way, way bigger than their individual effects, creating this powerful new lane for an old disease like TB to come roaring back.
So you're facing this new tri-epidemic. How in the world do you even begin to fight back? Well, the very first step is to get better information and get it faster. And that requires some real innovation.
On the front lines, clinics are really held back by TB tests that are just too slow and too expensive. And a huge piece of the puzzle is being able to spot the drug-resistant strains because they need totally different, much more intense treatments. The official numbers suggested that drug resistance was sitting at around 6% in these border clinics. But as it turns out, that wasn't the whole story at all. To fix this, researchers rolled out this new, low-cost color plate for growing TB cultures, and wow, the impact was huge. The cost plummeted from about $100 a test to less than $5. The time it took to get a result? It shrank from over 2 months down to just 17 days. And here's the real kicker. It revealed that the true rate of drug resistance was almost 18%. That's 3 times higher than anyone thought. This little tool didn't just speed things up, it uncovered a hidden crisis. But innovation isn't always about some brand new, shiny gadget. Sometimes the most powerful solutions come from a really simple but much smarter strategy.
Researchers actually described their approach as picking the low-hanging fruit. Basically, just finding the easiest, most impactful things you can do. And in this case, that meant using something that was already happening every day, the simple TB clinic visit.
The strategy has a name. It's called opportunistic screening. And it's such a brilliantly simple idea. When a patient comes in for one thing, you use that same visit, that opportunity, to check for something else they're at high risk for. Let me walk you through how it works. So imagine a person who is in close contact with someone who has TB. They come into the clinic for a routine checkup. They get their normal TB screening, and then right then and there, at the same visit, they're offered a quick and easy screening for diabetes.
No new appointment, no extra travel, no hassle. Simple.
So why is this so incredibly powerful? Because these TB clinics are the perfect place to find these hidden cases of diabetes. In one study they did in this region, a massive 30% of people who came in for a TB contact checkup were found to have diabetes. And get this, of that group, over a third had no idea. They got a brand new diagnosis right there in the clinic. That could literally save their life.
Of course, new programs always cost money, right? So the researchers had to ask, is this strategy actually worth it? Their analysis boiled it all down to one key number: $32,642. Now, in the world of public health, there's this metric they use called a quality-adjusted life year, or QALY. It's basically 1 year of perfect health. And the rule of thumb is that any program that costs less than $50,000 to gain one of those years is considered very cost-effective. This screening strategy, it comes in at just over $32,000. So yeah, it's not just a nice idea, it's an incredibly smart, efficient investment in the health of a whole community.
So, after going through this whole complex story of 3 intertwined diseases, what have we really learned? Well, it all boils down to one simple idea: connecting the dots.
For way too long, we've kind of treated public health in these separate boxes. TB is handled over here, diabetes is over there, and infectious diseases are in a whole other department. But this tri-epidemic is a perfect example that our biggest challenges, and it turns out our most effective solutions, are found in the spaces between those boxes.
So let's recap. We've seen how a biological perfect storm is making a health crisis even worse. We've seen how cheaper, faster tools can show us the true size of the problem. And we've seen how a simple, smart strategy like opportunistic screening is a super cost-effective way to protect people. The common thread through all of it is integrated care, seeing the whole patient and the whole system all at once.
And that really leaves us with one last question to think about. This story showed us how a simple TB clinic could suddenly become a major frontline in the fight against diabetes. It really makes you wonder, if we start connecting the dots like this everywhere, how many other massive health crises could we solve just by looking for answers in the most unexpected places?